So fever has many types of ways that you can enter a fever, right? You have patterns in the fever where you can see a stepladder kind of fever. You can see a periodic fever or a fever that comes suddenly, goes suddenly. We know all this. We also know what happens in the chill phase, what happens in the heat stage, whether the patient is a patient who is dry or who sweats or who has thirst. We also know whether the patient has headaches or if there's a certain system that is involved in the fever. There are so many things that come when we think of a patient with fever. Now, with all that information that is given to us, we have to reach one remedy, and that remedy has to be effective for the fever. How do we do that? Do we look at it via the pattern? Do we look at it via the thermals and thirst or the PQRS symptoms that we get during the fever? Do we look at it according to the system that is involved, whether it's the respiratory tract or whether it is the GI tract, or what exactly is happening in the fever? How exactly are you going to approach a case of fever and find the accurate remedy which is going to work 100% in your clinic while the patient is taking the remedy and go out without the fever and be completely cured? That is what I'm trying to help you in attaining when you attend my webinar on fevers.